Now this is really just an overview. I know that our civilian PTI presenter and our pelvic floor presenter, our physio presenter, will go over this in much more detail, but just to give a brief rundown. Noting that postnatal is generally considered around 12 months. What changes can we expect? Well, the uterus starts to shrink back down, and that returns back to a pre-pregnancy size around 6 to 8 weeks. The cervix goes back to its baseline at around 3 or 4 months after a delivery, and bleeding. This can last for around 6 weeks after a delivery. It's often a lot heavier than someone's normal period, and it turns into something called lochia, which is kind of an increasingly watery pinkish brown, and then eventually yellowish white, and that can be up to 200, 500 ml per person. The abdominal wall muscular tone may recover fairly quickly, but that diastasis recti, or separation of the abdominal muscles, can persist. The perineum, even after a normal vaginal delivery, that can be incredibly traumatic to that area, so making sure that people have sufficient pain relief, stool softeners, ice packs, things like that. Cardiovascular system. During pregnancy, the plasma volume expands by up to 50% to allow for the extra bleeding seen at delivery. The cardiac output also increases by up to 40% compared to non-pregnancy, and the heart rate increases to increase the cardiac output. And after birth, within 10 minutes, that cardiac output has reduced back down significantly, and the heart rate returns to normal over a short period of time as well. Hematological changes, we know there is increased red blood cell production, again to help compensate for that bleeding at delivery and afterwards. But as we've spoken about in a different presentation, that does mean that the risk of clotting, like in the leg or in the lung, is a lot higher. And this risk doesn't go back to baseline until at least 6, if not 12 weeks postpartum. And lastly, breasts, they can feel very full and firm when milk comes in a couple of days after delivery. Right up to this can be incredibly painful, and people are needing a lot of pain relief and ice packs to manage it. There's some physiological changes as well. So getting back to activities, driving. Some people after a C-section may not be cleared to drive until around 6 weeks after their surgery. It's because they need to be able to slam on the brakes without pain in order to go back to driving. Sex, very occasionally, a birthing parent may be ready, even a month after delivery, but that can vary significantly. Note also that the hormone changes postnatally, particularly if breastfeeding, means a lower estrogen, and then that can contribute to significant vaginal dryness and discomfort during sex. Exercise, this again will be discussed a lot more by our civilian PTI, but stressing that there is no rush from a medical perspective. There is no rush for people to get back into their fitness test. We want to make sure that they are safe and they are cleared, for example, by their postnatal physio before they start working up to that. Weight retention and weight gain is, of course, a big concern for birthing parents, and we know that the average retention about 6 months postpartum was 5 kilo, but a retention of around 9 kilo is fairly common as well, and at least a quarter of birthing parents. Other changes you might notice are stretch marks or striae, so they might fade from that red colour to a more silvery colour, but those generally are permanent. Abdominal skin may remain lax. Hair loss, there can be significant hair loss in the months after pregnancy. Effectively, the normal hair cycle during pregnancy is paused, and it sort of makes up for it after baby comes. And then lastly, thinking about risk of infection, so surgical sites, so the perineum, any tearing or episiotomy sutures, and of course cesarean section sutures. You can get infections in the breasts, like a mastitis or an abscess, and an endometritis as well, which is an infection of the lining of the womb. Lastly, just touching on the postnatal changes and just noticing the dramatic drop, particularly in things like progesterone after birth. And this might not increase again until after the first cycle returns, and the return of cycle can be a month, can be many, many months after delivery. It's very individual. And that progesterone is going to contribute to symptoms of moods and anxieties. That drop in estrogen for lactation. Estrogen helps to facilitate serotonin pathways, so one of our kind of happy chemicals. The estrogen can also contribute, as we've discussed, in terms of vaginal dryness. Plasma corticosteroids decrease significantly in the hours after birth, making that a very vulnerable time. Things like prolactin and OxyContin can actually have a very calming effect. And you're looking at overall at least 6 to 8 weeks, if not more, of these major hormonal changes. So if you think about someone going through this and significant sleep deprivation and trying to take care of a newborn, you can imagine why it's quite a significantly stressful time period for a lot of people.